I wanted to talk about COVID, and I felt like I was watching a horror movie that I was forced to watch, and I wasn't allowed to close my eyes. So I'm happy to talk about COVID and point out things that were so wrong and so arrogant, and how it's resulted in so much distrust. But the reality is most people are sick of COVID, and it's become so tribal. So I wanted to really focus this book on what we saw over the last 10 years in the medical establishment that mirrors exactly what we saw during COVID. Misinformation put out by the government, groupthink, herd mentality by the medical oligarchs, how a small group of medical priests at the top tell every doctor what they should believe.
Welcome to another episode of Counterculture, the show that stands at the intersection of reason and faith in the battle against sentimentality. The COVID response was the most pronounced case of the madness of crowds this century, but not the only one in public health. From peanuts to processed foods to opioids, our vaunted public health experts have gotten it wrong time and again. These failures and others are taken up by Dr. Marty Makary in his new book, Blind Spots. During COVID, Makary became one of America's leading voices of reason, in my view, offering expert assessments of the COVID response policies pushed by CDC and NIH, as well as public pronouncements from the likes of Dr. Tony Fauci, though, unlike Fauci, Makary never claimed to be the living embodiment of science. Now, with perhaps a renewed public interest in making America healthy again, to borrow a phrase, Dr. Makary is well positioned to continue guiding us around the politicization of medicine and the attendant sloganeering, and two sensible public health policies that actually follow the science. Dr. Makary is a professor at the Johns Hopkins School of Medicine and Bloomberg School of Public Health, chief medical advisor to Sesame Care, the author of the award-winning The Price We Pay, What Broke American Healthcare and How to Fix It. And again, his new book, our bestseller, is entitled Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health. Dr. Makary, thanks for joining us on Counterculture. Appreciate it.
Great to be with you, Dan. Thanks for having me.
So, was COVID the last straw for you? Is that what prompted the book? You know, as I mentioned, you go through a number of health crises that turned out to be largely expert generated, or at least in substantial part. And I just wonder if COVID was the final, like, we have to stop this cycle that we're in with the public health community.
Well, COVID was a peek into how a broader medical establishment works and functions. And, I wanted to talk about COVID, and I felt like I was watching a horror movie that I was forced to watch, and I wasn't allowed to close my eyes. So I'm happy to talk about COVID and point out things that were so wrong and so arrogant, and how it's resulted in so much distrust. But the reality is most people are sick of COVID, and it's become so tribal. So I wanted to really focus this book on what we saw over the last 10 years in the medical establishment that mirrors exactly what we saw during COVID. Misinformation put out by the government, groupthink, herd mentality by the medical oligarchs, how a small group of medical priests at the top tell every doctor what they should believe, the sort of mind control of controlling all the media channels on what people should be thinking about everything from, taking the hepatitis B shot at birth, upon delivery, to the flu shot, to the food pyramid. We don't talk about these important topics like gut health and the microbiome. I wish the medical establishment would take maybe 5% of the absolutism they have about newborns getting the hepatitis B vaccine as opposed to getting it later in life, and talk about our poison food supply and our chronic disease epidemic. So for the first time now, we're seeing some momentum where through the Make America Healthy Again movement, through a lot of sort of moms out there who can tell, hey, I'm doing everything I should be doing, and why is my kid getting an autoimmune disease, autism, cancer? Why is my kid obese? All of these chronic diseases are surging in our generation. And we've got to ask why. That's something the medical establishment is not doing. It's in their blind spot.
On this misinformation piece, since that's such a popular word, you testify, or I remember when you testified before the Select Committee on COVID in the House with Dr. Jay Bhattacharya and others, and you said the government was the largest purveyor of misinformation during COVID, which is, it's a pretty stark statement. But it's true, and I wonder if this repeats itself too in other instances of expert-generated public health crises. One of the things that you talked about a lot, I remember we talked about a lot with you, is discarding things we know to be true, like natural immunity. Well, so how do you discard like a basic tenet of science that you know to be true, that has stood up throughout the annals of history? You just discard that. Is that, I mean, like this, I think, is what people have a hard time getting their mind around, and so conspiracy theories enter. That it's about an alliance with Pharma, and it's about control, and they're trying to do this and they're trying to do that, because it doesn't. There's no logical explanation to do what they did, just to use that as one example. And so I wonder how you understand how something like that happens, and if you're seeing this repeated in other instances as well.
It was really remarkable to see it. I couldn't believe what I was seeing. Smart doctors sort of pledging this allegiance to a broader groupthink, almost like you see people in China pledging allegiance to the Chinese Communist Party in order to get promoted in their careers. And they were so intellectually dishonest. And when we started talking about natural immunity, some people were asking me, how did you discover natural immunity? And I'm thinking, gosh, it's been around since the Athenian plague of 430 BC, right?
So yeah.
But you almost saw this sort of naked partisanship, this sort of surrendering your own ability to think critically just to support a common, broader political endeavor. And it was so hard to watch. I mean, just the dishonesty of it. People had circulating antibodies that neutralized the virus through natural immunity, but they were antibodies the government did not recognize. They only recognized the antibodies generated by the vaccine. So it was so frustrating. And really, groupthink is a powerful force in so many areas of medical dogma outside of COVID. There's a psychology to groupthink. The doctor who first described this, the psychologist Leon Festinger, basically said, as a part of the human condition, we'll just surrender independent thinking to what a majority believes, especially if we like that majority's message on other unrelated topics. We believe what we hear first, not because it's more logical or scientific, but just because it settles into the brain first. And then we will subconsciously dismiss new information or reframe new information to make it fit what we already believe, so we don't have to let go of our belief. And you see that in politics all the time. You see it in business decisions, and you see it in science as well.
But I mean, it's like if a bunch of math professors got together and declared that 2 + 2 is 5, people would ask questions. People are like, wait, what is the motivation here? And I guess, I mean, sort of politics, like you're saying, and this sort of mass delusion. I mean, this is, another concept that is a couple hundred years old. Was it Makary, right? Who wrote the book in 1840, Popular Delusions and the Madness of Crowds. And so it's and the dynamic, it seems too, and we've talked to psychiatrists about this, is the delusion happens a group at a time, and the deprogramming happens one at a time. And so it takes so long to get so many people back to both feet firmly planted on the ground.
That's right. And that's exactly what we saw. It was the sort of popularity of delusions and the madness of crowds. And you wanted to say something. And it was like, no, you're not a physician, or then you're not a public health researcher, or you're not at one of the big academic centers. And they would just find a way to dismiss every single person that was using common sense until they got to me. And all of a sudden, it's like I had every credential that you're supposed to have. And then it was just like, well, just cancel them, just censor them. Same with Jay Bhattacharya. So the most dangerous thing a government can do, Dan, in my opinion, is fire the two top experts at the FDA that oversee a vaccine because they disagree with its emergency use authorization for young, healthy children, and then mandate that vaccine booster for young, healthy children, and then silence the doctors who disagree. That is like the most dangerous thing a society can do. Now, the vaccine didn't kill everybody that took it. So, overall, the harm was, um, not as catastrophic as it could have been. But that is a very dangerous thing a government can do, especially a government that values free speech. And we watched it. And by the way, we watched it over the weekend. Dr. Jay Bhattacharya organized a conference to evaluate COVID policy at Stanford. I was a part of that conference. I was on a panel with about 7 people, I would say most of whom were traditional COVIDian sort of mainstream thinkers in supporting the COVID restrictions and COVID government policies of Dr. Fauci. I was sort of one doctor with a different opinion. And it's like, you're not allowed to have this discourse. The Stanford Daily or whatever that newspaper is at Stanford sent out an article in their newsfeed that, Stanford president gave opening comments to a conference that included controversial people. Well, we
Right.
didn't. We wanted schools to be open after 6 months. That's the controversy. Those are the people who are controversial, or the people who insisted on shutting down the schools for a year and 9 months.
Right. No, I mean, 100%, but they have to cover their tracks too. I mean, they have to stick to the story they've told, because otherwise, if what you're saying is true and what you're saying about what they did is true, then there's a lot of culpability there, if, morally and professionally at minimum.
I think you saw sort of a broader story of America come out. A ruling class telling everyone else what they should be doing. And for the ruling class, look, life was not bad. I mean, for most people in America in that ruling class, life was good. You just wore pajamas and jumped on your Zooms. Your kids were at the country clubs. You had your private
Mhm.
tutors. They were in private schools. I mean, life was not bad unless you had lost a family member during COVID. Overall, it was like a liberating, almost fun experience for some people in the ruling class. And but come to inner city Baltimore, where I practice medicine, and it was brutal, right? And the untold story of the ruling class's restrictions on America is its disproportionate, heavy impact on poor and minority communities. And to this day, that story is rewritten by politicians. I can't believe it's not a bigger issue in the election, to be honest.
And so, based on that conference at Stanford you recently attended, do you get any sense that there are any recriminations coming from the great swath of public health experts, such that the next time a virus like COVID or something, something that's contagious like that and potentially deadly, that will do anything different?
I have, well, I don't know about you, Dan. I have not heard a single apology from any of the public health officials during COVID who made
I think
any one.
the closest we got maybe is Redfield at CDC.
Yeah, I mean, Redfield, I mean, look, we'll give them all the grace in the world when COVID initially hit this country, but then digging in, telling toddlers, 2-year-olds, to wear cloth masks for 3 years, insisting on schools to be closed for a year and 9 months, not allowing family members to visit their dying loved ones in the hospital, a cruel human rights violation that persisted for 2 years. I mean, I have not heard any apologies from any of these folks that really dug in deep. And to this day, I mean, I don't know if you saw the Kamala Harris campaign is continuing to ignore natural immunity by requiring the COVID shot for anyone who wants to work on her campaign,
Right.
regardless if they just recovered from COVID.
How about FEMA? The news out just the other day. FEMA, amid the natural disasters that we're supposed to be tending to in the southeast, of course, um, they spent $4 billion on uh, COVID related matters in September last month. Four
Yeah.
billion dollars. That's the most they've spent in a month on COVID since October of 2023. What are they spending it on?
So FEMA will call you if, let's say, your family member dies and said, if they died from COVID, we will cover their funeral expenses up to $9,000 and $30,000+ per application or household. And so they're sort of out there on the prowl with staff, aggressively reaching out to individuals to see if they can give them money for the COVID, for their funerals, if they died from the COVID virus, not from Coxsackie virus or pneumonia or avian flu or influenza or rhinovirus or HIV or any other virus, but only if you die from COVID. Then they want to give you thousands of dollars, and they on their website, I just tweeted this out, are going to continue that program at FEMA until 2025. Meanwhile, they're giving $750 to a household that loses their home to a flood and is homeless and in despair. That's an American tragedy. And the Mayorkas is saying FEMA's out of money. They just can't pay for, they don't have enough money to get through the season. This is incompetence. It's government corruption. And people need to know exactly what's been going on with FEMA.
Is that just them padding their stats? Is that what they're doing?
So it's unclear what their motivation is, but it was just a program they set up a long time ago and is supposed to run until September 2025. That they're going to cover the funeral expenses. So if you die of breast cancer, you're on your own. But if you die from a number of causes and COVID is listed on the death certificate, the government's going to pick up all those funeral expenses.
Well, this is what they were doing, though, from the outset, right? I mean, you have the famous cases of a guy dies in a motorcycle accident, but he had COVID, so that's a COVID death. For example, sort of an extreme example, but you get the point of them. They're looking to justify the position they've taken, sort of regardless of what the underlying rationality is.
Yeah. Look, if you overcount COVID deaths, you make the virus look more dangerous than it really is. And if you undercount vaccine injuries, you make the vaccine look safer than it really is. COVID was real and it hurt a lot of people. But if folks are angry, you should be angry at the dishonesty with the data, or maybe get angry at the mad scientists that brewed this up in the laboratory. The entire nightmare of 20 million deaths worldwide and the restrictions and the impact on poor and minority communities was entirely avoidable had a bunch of scientists not been messing with a bat coronavirus in a laboratory. So a lot of folks are angry that somebody was not wearing a mask, or, if you go back 4 years ago to this date, Dan, the prevailing attitude among the sort of party of science politically, the Democratic Party that claimed to be the party of science, was basically saying, if only Donald Trump would wear a cloth mask more frequently, we could beat this pandemic. Remember that? That was actually that was a major election issue. Like in town hall with Savannah Guthrie, she just pressed him on why you don't wear a mask more. And, it's amazing. People will be so angry during COVID, but they're not angry at the scientists that gave us COVID.
Right. And they're not angry at politicians in this country who are not getting to the bottom of what happened in Wuhan, or holding the Chinese government, accountable. They're not angry about that either.
Part of my book, Blind Spots, is about the importance of civil discourse and using science. The worst thing you can do in medicine is to put something out there with such absolutism as if it's scientifically supported when it's not. It's just a gut feeling you have. And we have seen that not just during COVID, but with so many health recommendations. And by the way, the censoring of doctors may explain why we have Tim Walz, because Tim Walz was elected in Minnesota as governor after running against a physician who ran advertisements, and those advertisements were taken down by Facebook for misinformation. This doctor, Scott Jensen, disagreed with Tim Walz on his COVID policies, campaigned on that, and his social media account was closed, and Facebook took down all his campaign ads. And now if you look at the timing, I just talked to Dr. Jansen, those campaign ads were taken down just 2 weeks after Mark Zuckerberg had acknowledged the pressure from the White House to censor people. And so his campaign ran with no steam in those ads at all, many of them censored, and he ended up losing by 7 points to Tim Walz in that gubernatorial race.
Right. Well, I mean, it's another area where there's just the declaration that the science is settled, meaning there is no discourse allowed, or certainly no pushback. You're allowed to applaud, but you're not allowed to critique, and you're not allowed to test the hypotheses or the findings of what is being represented as the evidentiary support. And that is the antithesis of science. I mean, science. The whole point is science is never settled because you're always yearning to gather more knowledge, have a better understanding of something.
That's right. The purpose of science is to challenge deeply held assumptions. And you'd be amazed how many things in medicine are based on assumptions without good evidence. And I go through a lot of those in the book. Opioids were not addictive for 20 years, igniting the opioid crisis. Parents should avoid peanut butter for kids until they turn 3. Well, that ignited the peanut allergy epidemic because kids need a little peanut butter exposure when they're infants. Um, Saying hormone therapy for perimenopausal women causes cancer when the data did not support that. That resulted in 50 million women and counting to this day being denied this incredible therapy called hormone replacement therapy. And the list goes on and on. The food pyramid is probably the most disastrous because by allowing the food industry to poison our food supply as the sort of experts in food medicine and nutrition put their heads in the sand about ultra processed food, added sugar, refined carbohydrates, pesticides, seed oils. We watched American children take on a whole new era of chronic diseases in ways we've never seen before in human history. And the medical field kind of blames the kids for being obese. You know, you're disobedient, you're not following our instructions, and then medicates them. It's like, what's
Right.
wrong with this? We can't keep going down this path.
Well, so like the opioids, as well as food, is that just a situation of agency capture by big corporate interests of regulatory bodies, or is there's something else going on there? Because I mean, sort of opioids and COVID intersect, so these are sort of there's a bit of a cascading effect there. And I also want to fold in Adderall too, because the ubiquity of Adderall. I mean, people that I know in pharma are suggesting that Adderall is going to be the next um, the next opioid crisis, with all these kids from a very young age on a Schedule II narcotic, and not a lot of research that demonstrates an understanding of what the impact of prolonged use of that at a formative age, what that impact is.
So it's a combination of industry capture and groupthink. So basically, what we saw during COVID, where you saw this cozy relationship, where basically Pfizer was telling you what to do, and the government leaders just sort of falling in line, and the groupthink, and how dare you disagree with these experts. That same story is a story that's played over and over again in healthcare. And with the food industry, you saw the demonization of natural fat. And meanwhile, they ignored all this poisoning of the food supply, and they wouldn't talk about it. There's no research on it. NIH is not funding research on food as medicine or the role of these highly engineered chemicals that are added to our food supply to make them more addicted, to actually increase your hunger level as you eat, something that has been disastrous for this country. Um, and so maybe we need to talk about school lunch programs, not just putting every kid on Ozempic. Maybe we need to treat diabetes with cooking classes, not just throwing insulin at everybody. And maybe we need to talk about environmental exposures that cause cancer, not just the chemo to treat it. We've got to start looking in our blind spots and talk about the root causes of what's going on, because we're on a terrible path right now. Two-thirds of Americans take a medication regularly. The average number is 4 medications. 20% of our nation's children now are taking a prescription medication. And in some cases, what we're medicating is the medicalization of ordinary life. I mean, you mess up a kid's circadian rhythm, wake them up early, not because it's good for their health, but because it's convenient for adults. Throw them in a classroom, tell them to sit sedentary at a desk, feed them a high refined carbohydrate sugar load at lunch, give them a food coma. They start dozing off in the afternoon, and they can't sit still. And then we say, you have a learning disability, you have a attention deficit disorder. Oh, the kid disagrees with what we're doing to them, and so we call that oppositional defiant disorder, and we give you a medication. We've got to stop and look around and realize what's happening. We're putting most of our nation's children on medication and on this path. That's where we're headed. And so we've got to start asking, can we design the schools differently? Can we make the school lunch programs healthy? Can we not mess up their circadian rhythm? Why does the average child in America today going to school get less sunlight than a prisoner in a federal penitentiary? Right? So kids need to be kids, and we've got to change our school system, not just put every kid on Adderall.
Well, right, and I mean, especially this was exacerbated during COVID, but is it 40% of kids under 18 have a mental health diagnosis? I mean,
Yeah.
that number is astounding, and so that drives parents and families right into the hands of pharmaceuticals, and I mean, I don't. What is your take on Adderall in terms of its potential impact on a generation of kids?
Well, with most mental health illnesses in children and most medications for mental illness in children, there are some appropriate indications. But the sort of broad dissemination, I was talking to a psychiatrist, pediatric psychiatrist, who I really trust, and he's trying to get kids off medications that other doctors have put the kids on, but the parents are like preventing him. The parents are like, oh, we've been told if the kid comes off they may not perform well in school. And the medical industrial complex has created this fear to parents, manipulating them, telling them if you don't do this, you're not following medical instructions for your children, and it's not in their best interest. And this is tragic, because he was saying that most of the kids on these medications do not need to be on them.
Yeah, I mean, that feels like the opioid thing all over again. I mean, if you read some about what the Sackler family did and others, and the other thing too is, it's not just in terms of the regulatory agencies in terms of their power to administrate regulations. It's also that funding. We talked about it with all the money that Tony Fauci had under his control at NIH. You compromise potentially robust independent research because these research institutions don't want to be thrown off the gravy train, the federal government's gravy train, $40 billion at NIH, for example.
Yeah, look, I'm in academic medicine, and I can tell you just from my experience at Johns Hopkins, um, our currency is research funding. That's the currency of how we do our work, of how we get promoted. Now, I've gone as far as you can go in the promotion world, but everybody needs research dollars. So when the guy giving out the research dollars is basically putting out position statements based on his opinion, and the medical field just claps like seals, what do you think's going on there? I mean, I can't tell you the number of doctors that have come up to me and said, gosh, everything you say, Marty, is spot on. I couldn't agree with you more. Keep doing it. I can't say anything because I need to get a research grant. So you raised another good point that I just want to touch on, Dan. The more Adderall we prescribe, the worse the situation gets. The more antidepressants we prescribe, the more people have depression. The more attention deficit disorder medications we prescribe, the more attention deficit disorder is. The more pain meds we prescribe, the more pain there is. The more antihypertensives we prescribe, the more hypertension there is out there. What is going on? The more Ozempic we prescribe, the fatter people are getting. What is going on? It's not the medications causing these problems. It's that we've got this myopic tunnel vision, and we've got to realize the root causes that we are not addressing that we need to address. And part of that is looking at our poison food supply.
And is this, I mean, do you put the attention squarely on government? Is it on big pharma? Is the corporate sector? Is it, I mean, where is it? Where should people say, like, if we need to change the paradigm for how we think about public health and all of these areas that you've described and others in your book, then should we focus on politicians and the administrative bureaucrats and how these agencies run? Should we focus on what Pfizer and the big pharma companies are doing, including buying, sponsoring every news program that's on the air. We only have so much attention span, and there has to be sort of a core at this that we have to get to. And I wonder, where that resides.
Gosh, it's such a good question, Dan. And a bunch of us doctors now are going directly to the public to try to educate them, not just on the health decisions for their own personal lives, but also on this broader system and what they can do. So I've written about this extensively in this sort of all these relationships in the book Blind Spots. Casey Means is out there now. Mark Hyman has a good podcast. Peter Attia, Vinay Prasad, Zubin Dabania. So a bunch of us are going directly to the public. In the past, the medical establishment could really control what you would hear about health. And you would just get all these conflicting studies and people would be confused. And you go in and this, whatever the doctor said, you would just be told you need to do whatever the doctor says. Now we're recognizing medical dogma has loomed so large and the medical establishment has gotten so many things wrong, they've actually ignited many modern day health crises that we've decided to go directly to the public. So I get into these issues in a lot of depth in the book Blind Spots. And the bottom line is, I think doctors are good people. They're just working in a bad system. And you want to find a doc who's honest, who listens, who's willing to say, I don't know. As a profession, we need to do that more. People in pharma are doing their job. They're supposed to develop medications, but now they have this disproportionate control over our research enterprise. And you can't really study anything unless pharma also likes the idea that's going to support their products. The NIH is supposed to fill the gaps, but we've seen what they're spending their money on during the little snapshot we got when COVID exposed where they spend their money. It's not on food as medicine. It's not on circadian rhythms in children. It's not on addressing childhood obesity or the rise in autism. It's not on autoimmune diseases that now afflict 1 in 5 women. It's not on the declining fertility rates in America. It's not on any of these true existential threats. They were giving their money to a laboratory in China to play with a bat coronavirus that they got from a cave 200 miles south. That is what our government has been doing, and that needs to change. I think it's going to take fresh new leadership.
Well, right, and it's also going to change, going to take a directional change, because it seems to me the problem gets worse and worse as government, does a greater backdoor takeover of healthcare in this country. So the government was the largest purchaser of healthcare in the country before Obamacare. Now that's exponential. And so that same dynamic, the censorship, the corruption, the conflicts of interest, it's just getting bigger as government's role is more dominant in the sector, isn't it?
That's right. And we need to take our government back. The pharma, big food and big ag, they feel that those agencies work for them. They feel that they own them, but they don't belong to them. They belong to us. People should get involved in their school districts, school lunch programs, for example. Why are tax dollars being used to buy this horrible food, this ultra processed poison food? The school lunch program should be buying healthy food, which may mean they need more money to buy healthier food. And sure, we may not like that investment, but try spending money on insulin for diabetes instead. We're watching our healthcare system engulf our entire economy. It's the largest business in America as of 2 years ago. It grew to that size. It's expanding at 8% per year in the commercial marketplace. And instead of addressing the root causes of all these medical expenses, what are our politicians doing? They're parading around, hey, we got Medicare to negotiate drug prices on 10 commercial drugs. Well, congratulations. They say that savings is $6 billion in a healthcare system that's growing at $200 billion a year. Don't be fooled by these shiny objects. The best way to lower drug costs in the United States are to stop taking drugs we don't need.
Dr. Marty Makary, that's always good advice too, to act locally. Your school lunch program at the school, what you're doing with the family, what's at the kitchen table. That's always a good place to start. Dr. Marty Makary, the new book is Blind Spots that we've been discussing in pertinent part. Dr. Makary, thanks so much for joining us. Really appreciate your time. Always great insights, a lot to think about, and continued success with the book.
Always great to see you, Dan. Thanks so much.
Please like this video and subscribe to this channel if you haven't already. And please leave a comment in the comment section. We'd love to hear your thoughts.